Hi, this is Hyunjin Kim, and in this pitch video, I am going to present a smart knee brace diagnostic device built on Arduino Enhanced Joint Evaluation Algorithm. Nowadays, 50% of the population all around the world suffers from lack of accessibility to necessary rehabilitation services in LEDC. Beyond that, after the outbreak of COVID-19 pandemic, 60 to 70% of the rehabilitation services have been disrupted by the worldwide health crisis. By developing smart knee brace diagnostic device, we try to solve the problem caused by severely limited accessibility of rehabilitation services. Due to socioeconomic reasons, the accessibility of rehabilitation services is limited to certain demographic groups. Also, there are comparably inadequate alternatives in the market for self-diagnostic tools. Existing diagnostic tools are considerably big in size and have more parts with segments to it, which makes the tools to be susceptible to mechanical failures. Smart knee brace diagnostic device has been developed to solve the problems of current rehabilitation market growing rapidly with much vision. Also, it distinguishes itself better than any other existing products in efficiency. The main purpose for developing the device is to offer an affordable alternative to individuals who need to keep up or maintain their knee joint health. Joints are constructed to allow different degrees and types of movement. Some joints, such as the knee, ankle, and hip, can withstand compression and maintain heavy loads while still executing smooth and precise movement. However, damaging the cartilage of joints or the bones and muscles that stabilize the joints can lead to joint dislocations and osteoarthritis. To develop the smart knee brace diagnostic device, concepts of yaw, pitch, and roll were introduced to utilize the main function of the device, which is to calculate ROM of the knee joints. ROM is an acronym for range of motion. Range of motion is the capability of a joint to go through its complete spectrum of movements. Range of motion can be achieved when opposing muscles contract and relax, resulting in joint movement. A traditional method for measuring knee range of motion is by using a standardometer, which is a specifically designed protractor that measures joint angles. This project attempted to develop an automated device using simple hardware from the Arduino Enhanced device and a laptop that could calculate the knee range of people. Competitive products include diagnostic procedures, KT-1000 arthrometer, GNRB ROTAP, and Imovi. As all these instruments need expertise or high maintenance cost, this competitive market presents an economic barrier to customers with average or low income. To analyze the existing market of joint clinical market, we introduced 6 independent figures following affordability, requiring professional attention, wide availability, material usage, accuracy, high-tech, and credibility. The customers who consist of current market are the ones who are prone to knee illness. These people have in common that they need imminent medical instructions. Tier 1 customers are people in general who may benefit from having their knees diagnosed. These people have common interest in their knee health. Tier 2 group of the customers is a refusing group, which consists of people who are wealthy enough to afford extremely expensive rehabilitation devices. They may prefer the devices that are more high-tech and expensive, which are therefore more accurate in measures. Tier 3 group of the customers is characterized as unexplored. These people usually do not have any interest or specific care on their knee health and willingness to use any kind of medical services regarding knee health. It is recommended to eliminate limited access to rehabilitation due to expensive knee diagnostics device. The barriers for using the product include unnecessary attached items, heavy weight, and high price. These characteristics are needed to be reduced to explore blue ocean for medical instruments. Thereby, we need to raise accessibility, efficiency, and simple structure. Moreover, characteristics such as simple but efficient detection device and more affordable way to provide knee diagnosis are needed to be created. This is the graph of our blue ocean strategy. Our newly developed device, smart knee brace diagnostic device, shows disadvantages in accuracy, high-tech, and credibility. However, it shows to have overwhelming advantages regarding other figures including affordability, availability, and etc. Smart knee brace diagnostic device is effective in differentiating the range of dynamic knee mobility of healthy subjects with those of subjects with previous knee injuries or issues. Our tool can serve as an advisory machine for potentially dangerous exercise patterns that could end up causing chronic knee pain, sprains, tendinitis, arthritis, and tendon without professional care. Our device demonstrated that there is a promising outlook for the integration of smart technology into rehabilitation.